I'm here to prove you don't need a diploma to educate yourself. We're going to do a deep dive in the Trump administration's complete disregard for the health and wellness of the people, and I'm not just talking the American people. I'm talking about citizens in general, because before you're anything, you're a person. Also, the Trump administration's complete disregard for the socioeconomic development of our society. We're going to step right into the devil's lair and pull some claims made by JD Vance and President Trump. They both have claimed that they care about fixing the American healthcare system by, quote, giving the money back to the people, but they're not very specific on what people they actually are referring to. And newsflash, it's not the American people. They claim they're doing what's right by the American people rather than playing politics, but we know that's a lie, and you're gonna find out soon why exactly that's a lie. JD Vance also admits Americans get crap healthcare and pay way too much for it, yet premiums are predicted to spike in 2026. And despite this, Trump is refusing to continue ACA healthcare subsidies, which millions of Americans rely on. And if you don't know what a healthcare subsidy is, I will explain that more in just a second. JD Vance nor Trump have been clear on how they will lower the cost of health insurance and, quote, give that money directly back to the people. Again, they're not being very specific on what people they're actually talking about. So, what's an ACA healthcare subsidy? An ACA subsidy is simply a safety net given to an eligible household making income between 100 and 400% of the federal poverty line for most states. Some states have expanded their Medicaid so much that most people don't rely on subsidies, but a lot of states still do offer subsidies, and a lot of people still do rely on subsidies, which pays for a majority of their healthcare plan, leaving the household to contribute less than 8.5% of their income toward healthcare. And households making above 400%, however, may still qualify for subsidies as of 2025. So, what is the Trump administration actually doing to our healthcare system? Well, rather than lowering the cost for American citizens through the one big, beautiful, or as I like to say, bullshit act, they will actually reduce costs for healthcare providers and ensure healthcare provider reimbursements rather than actually lowering the cost for premiums or out-of-pocket costs for families. The OBBBA will also limit access to ACA coverage. Open enrollment for ACA subsidies will be limited to 6 weeks instead of 10, and automatic re-enrollment will be eliminated. And ACA subsidies will be discontinued moving into 2026, so that safety net will be completely taken away, which will already cause thousands of Americans to lose healthcare coverage. Along with taking away ACA subsidies, the OBBBA will be limiting Medicaid coverage. Starting in 2027, you will be required to work 80 hours a month minimum to qualify for Medicaid coverage, and the OBBBA will reduce Medicaid retroactive coverage from 90 days to 1 month, restricting newly eligible people's access to medical care during emergencies. So, why is this so problematic? Well, not everyone who originally qualified for Medicaid coverage is able to work 80 hours a month, and Medicaid retroactive coverage actually prevents people from going into medical debt while still waiting for approval through a 90-day leeway period. And Medicaid is one of America's biggest safety nets, providing medical access to millions of Americans since 1965, and it has expanded so much since then. Along with restricted Medicaid access, there will also be restricted Medicare eligibility. The OBBBA legislation states that access to Medicare is only accessible to U.S. citizens, lawful permanent residents after a 5-year wait period, and 3 Pacific Island nations currently occupied by the U.S. military. And the legislation also denies Medicare access to refugees, self petitioners of the Violence Against Women Act, certain asylum seekers, and spouses and children of U.S. citizens with pending citizenship status. And it's very important to note that Medicaid and Medicare has never been available to people without legal documents, with exceptions. So, pregnant women, children, asylum seekers, and Even most immigrants with legal documents don't have qualified status, which contradicts Trump's claims of Democrats giving free healthcare to illegal aliens. And if you feel the need to call somebody who lives in a different country than you an alien, then you need to rethink your ideologies. So, who exactly will lose access to medical coverage? The Congressional Budget Office estimates over 8 million U.S. citizens will lose Medicaid coverage due to the $800 billion cuts, as well as disabled people, students, elderly people, high risk pregnant women, postpartum mothers, people with unpredictable or chronic disease who don't qualify for disability, stay at home dads and moms, caregivers for family members, recently incarcerated people trying to start a better life for themselves and reintegrate back into society, people with unstable part-time jobs, people who are seasonal workers in rural areas, people with substance abuse disorders, domestic violence survivors, asylum seekers, spouses and children of U.S. citizens with pending citizenship status, people in general with pending citizenship status, people whose deportation status is on hold, and regardless of where this legislation falls constitutionally, it is beyond immoral to deny a society access to universal health care due to money or because there are bad people in the world. For every horrible person, there are at least 5 good people, and more so, when in a supportive and expansive environment, people can change. Furthermore, the Trump administration is punishing states for helping immigrants. A healthy developing economy does not demonize immigrants. The Trump administration's OBBBA penalizes states for using their own money to cover eligible documented and undocumented immigrants by reducing their federal medical assistance percentage to 80%, rather than the FMAP solely being calculated through the state's income levels, which will double the cost of Medicaid expansion and pressure those states into canceling their own medical programs for deserving people. It's worth it to note that it's not within the federal government's authority, and it's quite immoral anyway, to withhold Medicaid funding based on legislation outside of the state's Medicaid program within its own income budget, and solely because they're simply helping immigrants. Again, a healthy economy, a healthy society does not demonize immigrants. The bill also prioritizes political favoritism by favoring some states, as the budget cuts only apply to states that have expanded Medicaid. So, for example, both Florida and North Carolina use the Legal Immigrant Children's Health Improvement Act, the ICHIA, which is separate to Medicaid, but it allows these children to have access or to become eligible for Medicaid. Only North Carolina will be forced to retract their medical programs because Florida hasn't expanded their direct Medicaid benefits. The Trump administration's One Big Bullshit Bill Act also contributes directly to the collapse of America's scientific and medical research and development. The Trump administration's OBBBA also cuts funding to developing medical and scientific research necessary for the ever-evolving health and wellness of our planet and societies. As a result, the National Institute of Health has seen about 2,500 grants frozen or terminated, which equates to around $2.3 billion in funds towards medical research and development denied. Similarly, the National Science Foundation has seen over 1,300 grants be cut, equating to around $700 million allocated to scientific research and development abandoned. For the NIH and NSF together alone, that equates to over $300 billion denied to the socioeconomic development and health and wellness of our country by the Trump administration. The funding cuts also include NASA, the National Oceanic and Atmospheric Administration, and the U.S. Environmental Protection Agency, among others. These budget cuts directly target circumstances related to diversity, equity, and inclusion, which has limited medical and scientific developmental research and inclusivity related to cancer, STEM, vaccine development, diverse immune cells, education disparities, etc. Through the description of my YouTube, you can go see how the health and wellness and socioeconomic development of your state and others have been directly affected by the Trump administration's legislation. So, where exactly is this money going? The OBBBA seeks to reallocate funding cuts to Medicaid, clean energy, INH, NSF, etc., towards a $150 billion increase in the U.S. military budget, ICE, and border wall financing. And some of these funds, and temporarily I might add, will be going to rich taxpayers making under $500,000 a year who are now able to make up to $40,000 in income tax, and married taxpayers who will get a $2,000 boost for filing jointly, and people over 65 may be eligible to receive a $6,000 tax deductible until 2028. These tax extensions will do nothing for low to middle class taxpayers and the ultra rich making over $500,000 a year. In conclusion, the issue with the Trump administration's big bullshit bill is not necessarily the tax extensions. That's honestly one of the least problematic issues with the big bullshit bill. And it's really not even an issue. But I believe it was created because most people haven't read into what the tax extensions actually are, and so it makes people focus on an imaginary issue rather than the actual catastrophes that the big bullshit bill is creating. So the issue is where the funding cuts from necessary institutions responsible for the health and wellness and socioeconomic development of our country, like the FIH, NSF, NOAA, EPA, etc., are being reallocated to. The Trump administration currently favors money, control, and conflict over the general health and wellness of our society. They have demonized Democrats, DEI, migrants, education, and anything progressive which goes against their agenda to divide and conquer. So stay informed and do not focus on distractions created for you to stay out of the loop.